Question 81. A male client's blood test results as follows: white blood cell WBC count 100, hemoglobin HB level 14, hematocrit 40%. Which goal would be most important for this client? A. Promote fluid balance. B. Prevent infection. C. Promote rest. D. Prevent injury. Answer B. Explanation. The client is at risk for infection because WBC count is dangerously low. HB level and HCT are within normal limits, therefore fluid balance, rest, and prevention of injury are inappropriate. Question 82. Following a tonsillectomy, a female client returns to the medical surgery unit. The client is lethargic and reports having a sore throat. Which position would be most therapeutic for this client? A. Semi-phallus. B. Supine. C. High phallus. D. Side lying. Answer D. Explanation. Because of lethargy, the post-tonsillectomy client is at risk for aspirating blood from a surgical wound. Therefore, placing the client in the side-lying position until awake is best. The semi-phallus, supine, and high phallus position don't allow for adequate oral drainage in a lethargic post-tonsillectomy client and increase the risk of blood aspiration. Question 83. The nurse inspects a client's pupil size and determines that it's 2 mm in the left eye and 3 mm in the right eye. Unequal pupils are known as A. Anisocoria, B. Ataxia, C. Cataract, D. Diplopia. Answer A. Explanation. Unequal pupils are called anisocoria. Ataxia is uncoordinated actions of involuntary muscle use. A cataract is an opacity of the eye's lens. Diplopia is double vision. Question 84. The nurse in charge is caring for an Italian client. He is complaining of pain, but he falls asleep right after his complaint, and before the nurse can assess his pain. The nurse concludes that A. He may have a low threshold for pain. B. He was faking pain. C. Someone else gave him medication. D. The pain went away. Answer A. Explanation. People of Italian heritage tend to verbalize discomfort and pain. The pain was real to the client, and he may need medication when he wakes up. Question 85. A female client is admitted to the emergency department with complaints of chest pain, shortness of breath. The nurse assessment reveals jugular vein distension. The nurse knows that when a client has jugular vein distension, it's typically due to A. A neck tumor, B. An electrolyte imbalance, C. Dehydration, D. Fluid overload. Answer D. Explanation. Fluid overload causes the volume of blood within the vascular system to increase. This increase causes the vein to distend, which can be seen most obviously in the neck veins. A neck tumor doesn't typically cause jugular vein distension. An electrolyte imbalance may result in fluid overload, but it doesn't directly contribute to jugular vein distension. Question 86. Critical thinking and the nursing process have which of the following in common? Both. A. Are important to use in nursing practice. B. Use an ordered series of steps. C. Are patient-specific processes. D. Were developed specifically for nursing. Answer A. Explanation. Nurses make many decisions. Some require using the nursing process, whereas others are not client related but require critical thinking. The nursing process has specific steps, critical thinking does not. Neither is linear. Critical thinking applies to any discipline. Question 87. In which step of the nursing process does the nurse analyze data and identify client problems? A. Assessment. B. Diagnosis. C. Planning outcomes. D. Evaluation. Answer B. Explanation. In the assessment phase, the nurse gathers data from many sources for analysis in the diagnosis phase. In the diagnosis phase, the nurse identifies the client's health status. In the planning outcomes phase, the nurse formulates goals and outcomes. In the evaluation phase, which occurs after implementing interventions, the nurse gathers data about the client's responses to nursing care to determine whether client's outcomes were met. Question 88. In which phase of the nursing process does the nurse decide whether her actions have successfully treated the client's health problem? A. Assessment. B. Diagnosis. C. Planning outcomes. D. Evaluation. Answer D. Explanation. In the assessment phase, the nurse gathers data from many sources for analysis in the diagnosis phase. In the diagnosis phase, the nurse identifies the client's health status. In the planning outcome phase, the nurse and client decide on goals they want to achieve. In the intervention planning phase, the nurse identifies specific interventions to help achieve the identified goal. During the implementation phase, the nurse carries out the interventions or delegates them to other healthcare team members. During the evaluation phase, the nurse judges whether her actions have been successful in treating or preventing the identified client health problem. Question 89. What is the most basic reason that self-knowledge is important for nurses? Because it helps the nurse to A. Identify personal biases that may affect his thinking and actions. B. Identify the most effective interventions for patients. C. Communicate more efficiently with colleagues, patients, and families. D. Learn and remember new procedures and techniques. Answer A. Explanation. The most basic reason is that self-knowledge directly affects the nurse's thinking and the actions he chooses. Indirectly, thinking is involved in identifying effective interventions, communicating, and learning procedures. However, because identifying personal biases affects all the other nursing actions, it is the most basic reason. Question 90. Arrange the steps of the nursing process in the sequence in which they generally occur. A. Assessment. B. Evaluation. C. Planning outcomes. D. Planning interventions. E. Diagnosis. A. E. B. A. D. C. B. A. B. C. D. E. C. A. E. C. D. B. D. D. A. B. E. C. Answer C. A, E, C, D, B. Explanation. Logically, the steps are assessment, diagnosis, planning outcomes, planning interventions, and evaluation. Keep in mind that steps are not always performed in this order, depending on the patient's needs, and that steps overlap.
Thank you for watching.